because this data comes from you guys, it comes from the patients, and obviously the parents have inputted it. I feel personally it's really important to give something back, and you're supposed to be learning stuff about your children, as well as obviously us being able to gather data, and then researchers can access it and hopefully find some treatments or at least some support for our kids. So that's kind of why we're doing this annually. So first of all, let's have a look. Next slide. So yeah, hello. So what is RareX? So I'm presuming some people might be on it, some people might not be on it. So I'm just going to kind of talk to everybody. It's free. We don't have to pay for it, so we get no charge. It's for all rare disorders, and it's fairly new, and they started off mainly for neurological disorders. So we kind of got in there early, and that means all the surveys that are there at the moment are really applicable to us, and they're also growing all the time. So there will be new surveys, and it will get better and better as time goes on. They say it's patient owned. So just to kind of put some kind of minds at rest, what does that mean? I mean, because that could mean lots of things. What it means is, do you have a say in your data and who sees it? Yes. So when you consent, you get to say, not each individual person, because obviously that would be very time consuming, but the types of people that you want to be able to see your data. Do you have a say in being contacted about your data? So say if a researcher wanted to be put in touch with you, for example, yes, you completely do. So again, that's something you can opt in or opt out of. If you want your data to be removed and forgotten, would that happen? Yes. So RareX works under GDPR standards, and it's like right to be forgotten. However, and this is where it gets a bit more like the line is blurred about patient owned. If your data has already been used historically in a presentation, and that might be on YouTube, is that going to ever disappear? Well, probably not. So you have to be aware of that. But really, the fact is that the data is de-identified, so your name is not anywhere near it. And so nobody would ever be able to identify you in terms of your data. Also, could your data, I guess this is really important, is this data that's being gathered being sold for a profit? Absolutely not. So they can't sell your data, and no profit can ever be made from it. So it's literally just the goodness of Global Genes who own RareX. They just want to help us. So what information do we get as parent advocate groups? So a parent advocate group is either a charity or like a non-charity that is advocating for a particular disorder. So monthly now, we're getting survey completion rate. So we know how many people have completed different surveys. We're getting general metrics, and I'll show you, you'll see what the kind of information that we get. However, the data that we get monthly includes carrier data, so it's all a bit skewed, so it's not massively useful. So what we've done for this presentation is I had to go in and specifically request all the data, but to have all the carriers removed, because obviously they shouldn't be showing any symptoms, so that would alter the prevalence of things. And so that's what I'm going to show you. So who are the RareX patient advocate groups? So they're all the foundations that have opted in to help RareX and assist them. So that's ourselves, CASK Research UK. That's ACNRF, Australia and USA. That's the one run by Giove. Association Enfants CASK France, which is run by Thierry. And the newest one is Project CASK, who are doing the presentation later on. So we've all agreed with RareX that we're going to support RareX. We're going to try and recruit, and we get something from that, because obviously we get good data to then hopefully get the attention of researchers and like forward our aims. So it's mutually beneficial. So why is it useful? Why do we want this data? From it, you'll see we can get a better understanding of CASK. So we'll know like the different symptoms, the prevalence. At the moment, most of the information that we have is from our individual children and from the Facebook group. And that is actually invaluable and probably as good as it could ever be. However, that isn't enough for doctors. They obviously need something that is that we know has come from actual CASK patients, and that's the only kind of data that can be used and published. So researchers need this data if they're going to study CASK, if they're going to develop new treatments and define outcome measures for clinical trials. And also, when we found this, it's expediting research, so it's moving things faster. So we've had a lot more attention since we've had Rare X, and we can say we've got over 100 participants from researchers. So it's already sped that bit up for us. We haven't had to spend a year looking for researchers, because the minute we tell them that, they want to be involved. And this is probably the fourth one is really important. So it's data as a control group. So what normally happens once you manage to get a treatment into clinical trials, you need a control group to compare. So for example, with cancer patients, if you had like 400 cancer patients, half of them would get the drug, the other half wouldn't, and you could compare outcomes. With rare diseases, there's not enough of us to do that and have that control group. And also, maybe not so much for our diseases, but for some that are, have 100% fatality rate, is that even ethical? So what they're starting to do and allow is to use data as a control group rather than actual patients. And that will hopefully, when the time does come, will be able to move us forward and actually get a drug through clinical trials. So for me, that's like super important. Okay, so this is now about the data that we've got. 110 respondents, actually 112 now, and you wouldn't be surprised that it's mostly females. Mostly white as well. That's probably because the Facebook group and the charities are like English speaking, and we have a lot of Americans. But there is a range, there is a variety, as well as ethnicity. And this is quite interesting. These are the ages we have. So you can see the largest age group is the younger kids, 3 to 5 years, and then 6 to 10. Now, there could be many, many reasons for this. That could be because parents with younger children are more incentivized to enroll onto Rare X. They're new to the disorder, they want answers, they're more anxious. Or it might not be that at all. It could be that our community just happens to have more of that age group. So this doesn't massively tell you anything, but except that I think these are in, yeah, these must be in raw numbers. We really need more of the older population. And I know there's not that many of us out there. However, if you know or you are in these age groups, 15 plus, your data is really vital because you have that historic data, and we can look at disease progression. We can't, from a 3-year-old, we can't get anything about disease progression, even from a 6 to 10-year-old. But from a 15 plus, we can start to understand disease progression, and that is really, really important. So from these surveys, we've got the top developmental concerns, according to you guys, are as follows. You can see, I'm not going to read them all out, but obviously motor movement coordination, abnormal motor development, probably, I mean, these are just terms and people will kind of read these in different ways. But yeah, I think our kids, like, they can't move their limbs and they don't have very good fine. Well, they can move their limbs, but not necessarily the way they want to. Some of them, they don't have the best fine motor skills. They don't have the best gross motor skills. So that's probably referring to that. And obviously, we're all really concerned about the communication issues. So, and we know that's pretty much across the board. although there is only 61 who said that's a top one. So we'll look at some of these in more detail, but this gives you an idea of how the community is feeling about developmental concerns. So you can maybe feel, that you're not alone. I was personally surprised about the poor eye contact, 42. I thought it would be higher, but my experience is my child. So that's why this is important, because we can get like a skewed impression of a disorder when our child is part of a spectrum. So when you register and you first look at the data, you will maybe remember there's something called a head-to-toe survey. And this is super, super quick. So if you haven't registered yet, you basically can do it on your phone, and it's just a yes or no. Is your child had cancer? Is there any cancer issues? They have blood or bleeding issues, heart or blood vessel issues. If you're not sure what exactly it's meaning or getting at, I would say yes. Because what happens if you say no, so say if you went to head, face, neck, so near the bottom, and you said no. Now, I think that actually then later asks you, do they have microcephaly? And most of us, I'm pretty sure, would probably want to say yes, and you wouldn't get a survey then that would ask you, do they have microcephaly? So I'd always say urge on the positive, saying yes to something, and then you can just ignore all the surveys. And if all the surveys you're getting are then redundant and not relevant, you can always go back and change surveys, by the way, as well. But this is the most important one, because this is what then tells Rare X which surveys to give you. And obviously if you say no to everything, you won't get any surveys. So I guess you could do that, but then there's not really much point being registered on Rare X, because it's not going to give us anything useful. So we decided, obviously we could talk for hours, and some of it might be useful and interesting, some of it wouldn't be, but we decided which points we were going to, which symptoms we were going to focus on. So we'll just start, don't worry, there's not too many. We'll start with epilepsy. And so the most important thing, I think the question everybody's always saying is, what is the prevalence of epilepsy? What is the chance of my child developing seizures? Now you can see so we have 112 people registered on Rare X, or 110 when this was done, but still only 49 people have answered this question. So some people are doing that first head-to-toe questionnaire and are either not clicking, like there's something wrong with the brain, or they are, but they're not completing the next surveys. And so that is like really important. Although 49 is a pretty good number, I have to say, in terms of like patient surveys and population size for a rare disease, we're doing really well. So what that shows at the moment is that seizure rates are about 31%. Abnormal EEGs are a bit higher. So that means obviously people are getting EEGs, are being told they're abnormal, but it's not being classified as seizures. So yeah, so like around about a third, which, is positive, because if you're new to the community, what that's basically saying is that you have more chance of not getting seizures than you have. So we need to be reassured as a community, but it is still important to look out for the symptoms. Now, if you answer yes to these, you then get onto another survey called the PEHLS survey. So this is data from people that have said, yeah, there are some issues. So this isn't from the entire community. So it's a bit weird, but the reason I wanted to keep it in is because of the ages. Because obviously, other than is my kid going to get a seizure, you want to know what's the most likely age they're going to get a seizure. This doesn't necessarily tell you that, but it gives an indication. The fact, we have very young children with seizures. So yeah, it doesn't give you loads of information, but I thought I'd include it. And then again, this is from the same survey, that secondary survey, really looking in depth into the epilepsy. Is it treatment resistant? So it looks about like 50-50. No, actually a bit more, because some were uncertain. I think, again, what is the definition of treatment resistant? We probably need some guidelines on how to answer this. Personally, for myself, I wouldn't really know how to answer it for my daughter. She still has seizures every now and then, but the medication does seem to work sometimes. So I don't know how that would actually be classified. So maybe I was one of the uncertain. And then what kind of seizures? Again, I think quite a few people probably don't know or haven't been told what kind of seizures their child has. Because until recently, my daughter's seizures had never been classified as either focal or generalized. So if your child has infantile spasms, which lots of ours do, which box would you tick? So again, this is a kind of information that we need to go back to Rare X with and say, can you give some guidelines when people are doing this survey, like help them? Or maybe it's these kind of webinars where we say, if you've got infantile spasms, now I'm not an epileptologist, but I believe it would be classed as generalized because I believe it's coming from all over the brain. If it's then, like my daughter's, for example, has improved and they're now saying it's just coming from one part of the brain, so that would be called focal. Some might have, well, some of you clearly have show both, and yeah, and some people don't know because either they've not been told or it's not, they don't know which box it fits in. So again, not like hugely helpful, but I don't know, might be useful to some people if they know which type it is. So this is probably quite useful for some people. Age of first seizure. So majority have it at the age of 1. I guess it says infant 1 month up to 1 year, but then more seem to develop it after 1. Now that's, yeah, so that is quite interesting actually, because the majority of our seizures are infantile spasm, they are, the definition of that normally, if you Google it, it normally says that the seizures occur before the age of 1. And so this is quite interesting that we're seeing something slightly different to what's in the literature. And that might be why some of our children are getting dismissed, their infantile spasms are getting dismissed because they're not like textbook, because they're starting a bit slightly later in life. And even a lot later in life, we know actually. I'm not sure if that data would be on here. But so that is really important. Again, treatment resistant. Well, that was the same one, isn't it? And there's epilepsy type. Okay, so that's about all the epilepsy. This is a really useful bit of information, prescribed medications and supplements. And I'll tell you a very quick story about how this can be really useful. So 60% of people responded to this survey. So what's the main reason for having medication? So seizure control, a keto supplement, sleep, drooling, constipation, reflux. I'm presuming most of our community can recognize these kind of reasons and issues. So I'll give you a quick little story to make this relevant. The other day, I had a nice phone call with another parent advocate group for a very, very similar disorder. And they're about 10 years ahead of us with their collecting their data. And one of the things they've used theirs for is they had a look at this kind of data, the medications. They could see what levels of medications individuals were on. And they found that for reflux, the main medication, reflux medications, their children were on an average of 3 times greater the dose than would normally be given for a child of that age or size. And their children had to be put on 3 times more because their reflux was so severe. Obviously, through trial and error, the pediatricians had gradually upped it to get control. So in their guidelines, what they now give new parents, the first thing they tell them is to get on a reflux medication, so like omeprazole, and it needs to be approximately 3 times greater than what you would normally give. And that is their like that's their general guidelines now for all new children with this particular disorder. And it has changed improved the lifestyle of so many of these children who are in so much pain. And one one story they told me was there was a child on like end of life care, and the pain was so bad and they were on morphine, and you know, they presumed this would like the end, terrible time. Anyway, it turned out it was reflux, and they just had to massively increase the reflux medication, and the child stopped crying, and apparently I think he's still alive now. So although like reflux just seems like one of those things that isn't that important, and reflux medication, you know, all young babies have a bit of it, it is like super important, and understanding the levels that are required of certain medications for our children to help that particular disorder, rather than a pediatrician just looking it up in like, oh well, what would we normally give, like having that extra appreciation of the disorder and some guidelines that are disorder specific can really improve the lives of our children. So that's why but they wouldn't ever have those guidelines if they hadn't have collected the data. And you know, I don't want to think what would have happened to that little boy. So another one I thought was useful to show you was on growth, because I do see the odd question about, oh, my child's quite small, on Facebook. So I just thought I'd show you the information we have. So this is from 55 respondents. So it's not unusual basically to be a bit short. It's not like, yeah, so don't panic, you know, it happens. And there we go. Okay, the next one is vision. 62 people responded to this. So major vision issues is minimal. However, yeah, you can see for yourself. So have normal eye movement, 25. But I presume like you can tick more than one of these when you do the survey. Visual impairment. So, you know, this is definitely, you know, it's not, again, you're not more likely to have this than not, but it's definitely something to make your pediatrician aware of. Behavioural concerns. Now, I'm not going to hugely talk about this because, as you know, we have 2 studies going on that are about behaviour and emotions at the moment, and they will have a report written, hopefully, I don't know, within a year, and then that will give like so much information about our community. But yeah, I mean, you can see that there are behavioural concerns. So don't feel alone if you're struggling with your child in that way. So they were the main, oh, hang on, sorry, communication, last one. Again, I think most of us kind of like understand how our child is, and we, you know, we talk to other parents with this, but yeah, gestures, words, a few use words. That's quite interesting, isn't it? Sounds, I mean, yeah, this is obviously like a really important aspect of the disorder. So how can you help? Obviously register if you haven't. Really need your genetics reports. I've got a slide on that in a minute. So we've come up with a kind of idea of how to remind people to update. So it's no good just filling in the survey once when your child's like 1 or 2 and then forgetting about it. I mean, it's better than nothing, but it's not that great. You have to do it every year, because then we'll get a longitudinal study and we'll be able to see the progression. So Rare X, I think, advises remind everybody to do it on their child's birthday. Well, I don't want to be sitting on the evening of my child's birthday filling in a load of surveys. I want to be having a glass of wine. So I'm not going to recommend that. I'm going to recommend using Rare Disease Day as your reminder, because, you know, like we might be buying T-shirts and doing the odd thing, but in terms of what we're doing in an evening, I think that's quite a good way to remember it. So we're going to be pushing that to the community. Rare Disease Day, or, you know, just use that as your reminder. Update your surveys, and they don't say this needs updating. You just need to go on them and just redo them. So you're not going to be told. You just have to do this. So you have to motivate yourself and just go through them. And some of them you might see the title and be like, oh, nothing's changed. Then maybe don't go back on it, or maybe do and just don't change anything, and then it will kind of know that you've been on it. So, and also if like something drastic changes with your child, you could, you know, when you think about it, then you can go on and change it. But kind of doing it annually is probably, you know, more than good enough. Also, yeah, let us know what problems you're having. So if you really struggled with the epilepsy survey, let me know and we can pass it on. And also tell your other CASK friends that you're on it and you've done it and it wasn't that difficult, because most of them you can do on your phone. And actually quite a lot of the time I do them when I'm in a hospital waiting room, because, you know, not much else to do. And you feel like you're actually helping your child. So as I said, we need your genetics reports. So we had the Bristol team present this data. This isn't exactly it, but the ones where you can see the NHS sign on the bottom left. There's some of the slides that I've taken from Victoria's presentation. What we really need is to be able to do a genotype phenotype study. So we've got all your symptoms, which is brilliant, but we don't have many genetics reports to match to that. So we really, really need that. And you can see how we're doing at the moment. So the number of genetic test reports that we've got on Rare X is 17. Now, this is out of 112 people consented. And the number of ones that people have uploaded, but they haven't worked, I don't know why they've not worked. Maybe they couldn't see them properly. Maybe it wasn't the right information, is 6. And I'm going to be talking to Rare X about how you know if that's you. And the number of clinic notes, so that's when it's a letter from a doctor, but it does have enough information in. So it's not a full genetics test, but it's enough, is 8. So, you know, it's not horrendous by any forms of the imagination, but it could be better, couldn't it? Considering we have 112 people, really, we want 112 genetic reports or decent clinic notes. And if you have a good phone, you can literally just take a picture and then you can upload it on your phone. But obviously you do need to be able to read it very clearly. And it's so simple, and there is a YouTube video that you can watch to tell you how to do it, but it's pretty self-explanatory. And from that, the information we have at the moment, which again, as I said, is not great, we can see the different kinds of mutations already. So from the missense, we've got uncertain significance. From the nonsense mutations, they've all been given MIC-PCH diagnosis. And from frame shifts, it's 60% MIC-PCH, 20% don't have enough data, and 20% X-linked intellectual disability, which is the other type of disorder. So yeah, we just need more data really, and then they'll be able to do some really, really good studies on that. So again, this was from the Bristol team. This is the future research they would really like to do, and it all depends on how good the data is from our community. Can we determine the contribution of different CASK mutations to different relevant behavioural deficits? So can they make links between, well, you've got this kind of mutation, so you're going to be a bit like this, or you've got this kind of mutation, you're going to be a bit like that. Is targeted treatment an option for CASK patients? Hopefully, yes. Are there any drugs that appear more successful in reducing seizures? Wouldn't we love to know that? So we're not just guessing, doing trial and error. And can we study further the CASK signaling and cellular pathways underlining the behavioural problems? So there are some teams doing that at the moment, and our funding that we've just provided is going to be looking at that. But it's so complicated. We need many teams and many, many studies to fully appreciate it. And that's all of us. So tips and tricks for completing your surveys. Find 1 to 2 other CASK parents and set a date for a Zoom enrolment party. Do one survey on the first day of each month. It's a good idea. All the information is saved and you can pick up where you left off. Create a CASK DCP phone tree with your CASK parent friends. Each time you complete a survey, text your friend to complete theirs. Yeah, guilt them into it. Tell them you've done it. As I said, you will be able to ask questions. Maybe just wait till I've reached the end, just so because I can't actually see everybody's faces during the presentation.